Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Efficacy of medication in young children with atopic dermatitis study finds. Research at National Jewish Health and other institutions has shown that the biologic dupilumab improves signs and symptoms of moderate to severe atopic dermatitis in young children, whether or not they have another inflammatory condition such as asthma, allergic rhinitis or food allergies. Dupilumab had previously been shown to be effective in the treatment of atopic dermatitis, but this research is the first to examine the drug's efficacy in children with atopic dermatitis and comorbid conditions. The study was recently published in the journal Advances in Therapy. Dupilumab has proven to be an important treatment for pediatric patients suffering from atopic dermatitis. A recent research was to help us know if the drug would be as effective in patients with both atopic dermatitis and other common atopic diseases that could add to the inflammatory burden, said Mark Boginiewicz, MD, pediatric allergist and immunologist at National Jewish Health and lead author on the study. Eat dark chocolate to lower the risk of type 2 diabetes, researchers. Consuming dark but not milk chocolate may be associated with lower risk of developing type 2 diabetes, according to a new study from the Harvard T.H. Chan School of Public Health. The study was published online in the BMJ. The researchers used data from the Nurses' Health Studies 1 and 2 and the Health Professionals Follow-up Study. Over the course of 30 plus years, 192,000 adult participants who were free of diabetes at the study's outset reported on their food habits, including chocolate consumption, as well as their diabetes status and body weight. By the end of the study period, nearly 19,000 of the total participants reported being diagnosed with type 2 diabetes. Of the nearly 112,000 who reported specifically on their dark and milk chocolate intake, nearly 5,000 were diagnosed with type 2 diabetes. Study reveals unique Alzheimer's risk and resilience in women after ovarian removal. New research published by a team of researchers from the University of Toronto in collaboration with colleagues from the University of Alberta has found that women who have had both ovaries surgically removed before the age of 50 and carry a variant of the apolipoprotein gene, the APOE4 allele, are at a high risk of late-life Alzheimer's disease. Use of hormone therapy mitigates this risk. The researchers analyzed a cohort of 34,603 women from a large data set, the UK Biobank, and found that in this cohort, women who had both ovaries surgically removed at the approximate age of 43 showed 4 times the odds of developing Alzheimer's disease when compared to women who had entered natural menopause at a mean age of 54. The paper was published online in the Journal of Alzheimer's Disease. One of our most important findings was the fact that loss of the naturally occurring hormone estradiol as a result of surgical removal of both ovaries might interact with the APOE4 allele to further increase Alzheimer's disease risk, placing women with early bilateral oophorectomy and APOE4 in a state of double jeopardy, said Dr. Einstein. APOE4 is known as the risk factor for Alzheimer's disease in the general population but presents greater risk in women. Induction of ovulation in women with PCOD. Device moves to clinical trial stage. Physicians at the University of Oklahoma Health Sciences in Oklahoma City are leading a national clinical trial to help women with polycystic ovarian syndrome (PCOS) related infertility who want to become pregnant. The trial, called Rebalance, studies the safety and effectiveness of an investigational device developed by May Health that is designed to restore ovulation disrupted by PCOS. Carl Hansen, MD, PhD, Chair of Department of Obstetrics and Gynecology at the OU College of Medicine, who is leading the trial for OU, said about 80% of women with PCOS respond to oral medications designed to stimulate ovulation, and up to 50% of those women will achieve a pregnancy. However, approximately 20% of women do not begin ovulating with the medications. An alternative treatment involves gonadotropic injections, which requires frequent monitoring and precise dosage adjustments. Another option, laparoscopic ovarian drilling, uses a needle-like device inserted through small abdominal incisions to deliver laser or radio frequency energy to an ovary, aiming to restore ovulation. However, this procedure has become less common, Hansen said. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.